Hi, good evening, everyone. I'm Dr. April Spencer, board certified surgeon and co host of UrbanMD TV. Now, UrbanMD TV is the first and only national TV network that is aimed at focusing on prioritizing health in in African Americans through a multicultural lens. So I'm super excited to be a part of UrbanMD TV. And today I have a special guest, Dr. Jones, also known as Dr. Nip and Tuck, to discuss all things plastic surgery. How are you, Dr. Jones?
I'm fine. How are you? It was a long day today. It's cold outside, and I'm just excited to be here to share some knowledge and talk to you and learn more about what you have going on, and just kind of share my experience with the general public.
Yeah. Well, this is a good time to have you on. In our last episode, we talked to Dr. Lauren about like healthy eats and treats. It's the top of the year, and we're all making New Year's resolutions. We're trying to eat better, get healthier, with the goal of perhaps losing weight. So we're exercising, we're modifying our diets. I'm even on a fast right now for 30 days, and so many people were aimed at having a healthier lifestyle, especially last year in 2023. And now in 2024, many of us are realizing I didn't reach my goals. I didn't lose the weight that I wanted. I'm still not as healthy as I want to be. Like, maybe I should consider plastic surgery at this point. And so I really would love for us to just chat about like when is a good time to have plastic surgery? Like, primarily, are you seeing an increase in particular procedures of plastic surgery? What are you seeing in terms of what's popular right now? What's popping?
Right. So those are great questions.
Hmm.
Well, now everyone, I think there's been a trend to try to, everybody wants something without putting in too much effort or too much work. And so there's been a trend
But a lot of
towards,
people have put in work. It's just not working fast enough. It's
yeah,
active. Come on now.
right. Everybody wants a quick fix. So I personally have had an increase in patients who want surgery, but they don't want to be put asleep. So they want awake liposuction, they want non-invasive treatments, they want skin tightening. Botox fillers have always been common. So probably the top three surgeries in plastic surgery are pretty set. That's liposuction is always at the top, breast augmentation, and abdominoplasties. But now people, like I said, they want less invasive procedures. So cool sculpting is very common, although I have my qualms about it. But awake liposuctions has been very trendy because people want to be able to have their procedure done and be able to go home. A lot of patients are also afraid of being put to sleep. With medical tourism, with social media, and everyone being more attuned to like what's happening with celebrities. Uh, a
Hmm.
lot of people just don't want to be put asleep, and they just want to get everything done awake. However, for some patients, that's really not an option, and for others, it may not even be the best option in order to get the result that they desire.
So let me ask you this, Dr. Jones. You said awake liposuction is very popular. That's trending. Is that trending in men and women?
Yes, yes. So anyone who wants a procedure, I think the general consensus is if I can get it done awake, I would prefer to get it awake.
So, and that would be my preference too. Although I'm a surgeon, I know there's anesthetic risk, and I would want something where I'm awake so I can see what's going on and feel more in control. So, walk me through what awake liposuction is like. That's one of the procedures that you talked about, and then maybe walk me through what the skin tightening and abdominoplasty. I'm
Right.
sure they're different. But yeah.
Okay, yeah, absolutely. So basically, everyone gets a consultation, and I first
Hmm.
have to determine if you are a good candidate for awake liposuction. Some of the same requirements for being asleep are also some requirements for being awake. The main one is you need to be healthy. Obviously, if you have
What
some
does that mean?
underlying medical, yeah, so if you have underlying medical conditions like hypertension, diabetes, asthma, and these medical conditions aren't controlled, you you wouldn't be a candidate for awake liposuction either. And the main
I
reason
see.
being, let's say you have hypertension and it's uncontrolled, you still have the same risk of bleeding while you're awake that just like you do if you're asleep. So basically, I want to make sure my patients are healthy, and then once I assess and if I feel like they're a good candidate, we can do the
Hmm.
procedure in comfort of my office. I give them a cocktail of medications. One anxiolytic, which is something just something to help out with anxiety, help calm them down. Pain medication, something for nausea, and then I use nitrous oxide, the same type of gas that they use in a dental office to make patients comfortable. And then we just go into a procedure room. I use the numbing medication, two medicines, and then I just go to work. One of the
Okay.
biggest advantages for me for doing it awake is the positions. Like you can position a patient however you want, and you by doing that you can hit vectors or angles that you may not otherwise be able to do while they're asleep.
So it sounds like what you're saying is with the awake liposuction, it's pretty much the same process as if you were asleep. So you take the wand and you're suctioning the fat underneath the surface of the skin in the front and the side because it's 360, so it's still all around.
Okay, look at you.
I'm just
Yeah,
asking. I'm
all the
just
way
asking.
around. Yeah,
You
yeah.
want to
So it's the
know.
same concept, same principles. The only thing is there are some limitations. So, for
Mm-hmm.
example, if like let's say you are undergoing awake liposuction and
Mm-hmm.
you're not a big person, there's a maximum amount of lidocaine that I can give. So, what does that mean for you? That means I may not be able to do as many areas during one setting for a smaller patient because I don't want them to have some sort of cardiac arrhythmia or a complication because of lidocaine toxicity.
Yeah. Yeah, because patients need to understand if you're interested in getting any sort of procedure done, that there are risk involved. And sometimes when you think cosmetic or aesthetic, it's kind of boutique and, I can just be in and out, but you still have to do your due diligence. So I'm glad that that is, a part of it. So that's really good advice. So with the skin tightening, some people have lost weight, right? So they met their goals, but they have sagging skin. So what would that entail briefly, like to tighten the skin, whether awake or asleep?
Right. So there are an assortment of energy devices to aid in skin tightening. So basically, for patients who otherwise the only option would have been to remove the excess skin, like for abdominal excess skin, that would be a tummy tuck. For your
Mm-hmm.
arms, that would be an arm lift. And so there are certain cohort of patients who may not have like a crazy amount of skin laxity. Like let's say they have mild to moderate skin laxity. There are other options that includes Vaser, which is ultrasound assisted. Basically, you pass a
Mm-hmm.
wand and it heats up the skin using ultrasonic waves, and it helps tighten the skin. And then
So
there's
is there
radio frequency.
like any incisions, like any cutting, or is it just using this
Yes.
ultrasonic waves to tighten? What's the deal there?
No, so you use the same incisions that you use for liposuction. So this is invasive. So there's ultrasonic, which is Vaser, and then there's also various forms of radio frequency energy, which include body type, face type, and one that I use the most is probably Renuvion, which used to be called J plasma. And basically, is radio frequency. The principle is you go in, you damage the collagen, your body creates new collagen, thereby tightening the skin. There are some that are non-invasive, but they're typically used more so in facial procedures. They can be used on the abdomen and the torso, but I
Hmm.
don't feel like you get as good as a result.
Now, Dr. Jones, you mentioned there were three trending. So we got the awake liposuction, we mentioned the skin tightening, and the last thing you mentioned was abdominoplasty, which is commonly known as a tummy tuck. So walk our
Hmm.
viewers through that. What does that entail?
Through a tummy tuck?
Mm-hmm.
Okay, yeah, sure. So abdominoplasty, most common patient that comes to me requesting this procedure, women
Mm-hmm.
after childbearing years. So when you have kids, your belly blows up, causes your skin to stretch out. You end up with stretch marks, loose skin, and also your muscles, your abdominal wall muscles, specifically your ab muscles, they end up becoming separated. We call that a diastasis recti. And so, come in, basically, what we do in the surgery, we remove the excess skin, tighten the muscle back up. So now you have your muscles centralized and you have a stronger core, your belly's flatter, and I get rid of the excess skin. By doing so, get more so of the Coke bottle appearance. And when I'm doing abdominoplasties, I always incorporate liposuction just to help get a smoother and a more refined result.
Got it. So thank you for walking us through like what's trending. So let's say patients want to have their plastic surgery done. Now some people have a conception that they can just pull up and be like, Dr. Jones, I have a wedding this weekend. Can you do my plastic surgery like tomorrow? So what is a realistic expectation in terms of um, what is a good surgical candidate? You kind of hit on that, but I really want our viewers to understand that it's still surgery, whether awake or asleep. So there's certain
Right.
qualifications. So what are the main things that patients need to be mindful of in qualifying for surgery, cosmetic surgery?
Um, yeah, that's a great question. So, one, first and foremost, they have to have realistic expectations. They first of all, they need to know what exactly they want, and we need to know why you're doing it. Like I feel much more comfortable and confident doing a surgery on someone who is doing the surgery for themselves, whether it's like they don't like their appearance or their breasts are saggy, they don't look the
Sure.
way they looked in the past, and they want to enhance the way that they look. And once we've established what it is that you want, and I feel that I can meet or exceed your expectation, I need to also know if you're healthy enough to undergo the procedure. And so, what does that exactly mean? Basically, anytime I operate on someone, I want to make sure you can leave the surgery center or leave my office and go home and continue your normal activities. And so, for most patients, that involves, collecting some information, a thorough history and physical exam. And the history is key. And a lot of patients, oftentimes, they fail to mention pertinent facts like, okay, I just had a heart attack 6 weeks ago, or I take a blood thinner, I take Plavix, or I just got discharged from the emergency room. All of these things are very important because it not only affects, what I'm doing as a surgeon, but also the anesthesia provider. Like the anesthesiologist needs to know that you just were discharged from the hospital because you had COVID and you're in the ICU for a month. Like all of those things matter. And so it's really important for the patients to be forthcoming so that I can make an educated decision on whether or not you're a good candidate for the procedure that you're requesting.
Yeah. So I hope you guys are listening. Like this is so important. So you can't say I had a light stroke, I had a mild heart
Right.
attack. You be forthcoming. And that when we're on our way out the door. Like you really it's so important because we want to do things safely. So I'm glad you mentioned that. The other thing is I just see, at least I've observed, is that plastic surgery used to be somewhat taboo. It's kind of like a dirty little secret. Like if you got some work done, you really didn't
Hmm.
tell anyone. And so, what do you attribute to this increase in patients or just people in general getting plastic
Right.
surgery done?
Yeah, so I really think it's our society, our culture, and also just how marketing has changed and the advent of social media. Everything is right in front of your face. And so, people used to be kind of, like you said, they didn't want anyone to know that they had surgery. But now you look at all these celebrities, they've all
Mm-hmm.
had procedures done. And it's almost like the more procedures you have done, the more acceptable it is. And so, people want to look like Nicki Minaj, they want to look like Kim Kardashian. And now they even have men. Men are getting surgery. Like Drake has Drake had surgery. Guys want their abs etched.
I was
Guys
gonna
want
say,
to
what are
look
they getting
more.
done? What are the men
Guys
getting
want
done?
to. Men are getting the same procedures women are getting done. I would say probably the most popular is some form of liposuction. Just like, I've had gym trainers, like professional gym trainers. They come in, they ripped up, but for whatever reason, they have a little pocket of fat in their lower back, and they want that removed. And of course, for me as a plastic surgeon, marketing for me is my patients. So if you're a patient, of course I'm going to ask, hey, do you mind giving us photo consent so that we can use your photos for before and afters to show other people. But those trainers, they do not want anyone to know that they had plastic surgery.
Wow, that's good to know. But now, okay, Dr.
Yeah.
Jones, what if someone is not a candidate for surgery, but they still want to lose weight, right? Or they still want to, have some slimming effects. So I know a lot of people are looking to the skinny shot when they're not a good surgical candidate. So what's up with the skinny shot? What is it, and is it safe?
So when you say skinny shot, that can mean a couple of things.
You know what
When
I'm
I think
talking
of
about.
when I think about skinny shots, I think about med spas, and so basically, that's not something that I do, but it's a shot where you inject multiple sites, typically in the abdomen, and it helps. It causes lipolysis or causes fat cells to die, and your body resorbs them. The other thing that commonly people refer to as skinny shot or weight loss medications like semaglutide,
Right.
tirzepatide, are also it's also known as Ozempic, Wegovy,
Mm-hmm.
and Mounjaro. And so
Right.
I'm more familiar with those, and I actually prescribe them to many of my patients. And I really
Mm-hmm.
like that drug because it I feel like it's changing people's lives.
Yeah.
It helps people lose weight. It lowers their risk for a cardiac event. Patients who are diabetic, it helps lower their hemoglobin A1C. And then for obese or patients who are overweight, as we know that being obese is a pro-inflammatory state, and so if you can lose weight, you're helping them long term. So
Mm-hmm.
arthritis, the risk of the cardiac, diabetes, and then also anytime pro-inflammatory state, I think about cancer. And so
Sure.
you're making you're I feel like you're really helping those patients.
Yeah, I agree. Now, I know you mentioned that plastic surgery is becoming more commonplace. It's not as taboo. So a lot of men and women are taking advantage of like medical tourism. Like, what are some of the dark sides of plastic surgery?
Oh yeah, I have firsthand experience with some of the dark sides of medical tourism because I oftentimes get a call from the emergency room, or I see patients in consultation as a result of botched jobs done elsewhere, or so I had a patient who was who flew in via helicopter from Dominican Republic because she suffered from a complication from a surgery she had in Dominican Republic. So basically, she was having liposuction, and they punctured her abdominal wall, and she had a small bowel injury. Her intestines were injured. She ended up in the ICU for a very long time, had an open belly, and basically she stayed there until she was stable, and then she had to come here and have a myriad of surgeries just to stabilize her. So my take on medical tourism. I'm not knocking any of their surgeons. There's great surgeons in every country. However, if you're traveling somewhere else, you don't speak the language, you don't know their hospital care system, and for me, the most important thing is uh, if you have that surgery there, whether it's successful or not, in the event that you have a complication, what are you going to do? You
Right,
don't know
right.
what you really don't know what you're buying. You don't really know what you're getting. You don't know the level of service that they provide. You probably don't really know who's doing the surgery. There's the standard of care is much different, and I just think I would not risk my life to have a surgery.
Okay, that's good to know. I think someone that can really weigh in is our special guest that is going to give her personal testimony on her experience with cosmetic surgery. She is Tamika Foster Raymond. She's a celebrity stylist, an author. She's also a designer. I mean, she's a serial entrepreneur in her own right for decades. And so definitely want to welcome you to the show, Tamika. How are you doing?
Awesome. This has
All right,
been
good. Well,
interesting.
yeah, well, you look great. You look great as usual. Why don't you start by just sharing with us and with our viewers what inspired you to initially think about getting cosmetic surgery done a couple of years ago?
Oh, that was about 13 years ago. It's been a long, long
Hmm.
time. Oh,
So
no,
what
goodness.
inspired you? Hmm.
Yeah, it was 15 years ago. Um, but my son just turned 15 and he was 2 months old when I tried to do this. I had a
Hmm.
baby and I had a little pouch, and it was a little pouch. I just thought I want to get rid of this fat. I had just had a baby and I was being foolish. I was a little premature, I think.
Hmm. And a lot
Hmm.
of people back then, and even sometimes now, we feel, a little, ashamed that we're getting it. We don't want to let people know we are getting some work done. So when you
Uh-huh.
went to get your procedure done, did anyone know? Did your spouse know? Did someone go with you? And where did you have it scheduled?
I went to Brazil. Um,
Mm-hmm.
I didn't I didn't go there initially with the intent of doing it. It was on my mind, but then once I started seeing all the Brazilian women walking around the beach, I was like, I'm gonna I'm gonna look into getting this done. So I had a
Yeah.
couple of consultations. I visited a couple of clinics. A couple of the clinics, they didn't speak any English, and I
Mm-hmm.
didn't think it was clean enough. It was like really old and not modernized and things like that. And I'm very into aesthetics, so I was like, this ain't the place. This isn't the place. This isn't the place. So I finally found a doctor that spoke really good English. I looked at his photos, the before and afters, and his office was new and immaculate. And so I decided to go with him.
Mm-hmm. And what did you want done?
I just wanted liposuction. I wanted my
Okay.
lower my lower abdomen liposuction because I
Yes.
had that pouch. But what I didn't
Mm-hmm.
realize is that my uterus. Think about it. I had just had a baby 8 weeks prior, and I had a normal pouch that you have after having a baby.
Yeah.
Yeah. I was,
Yeah.
mhm.
So walk me through what happened. Like, did you even get your procedure done?
No, 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 no,
Okay.
no.
So what
I
ended up
met
happening?
with I met with the doctor, prior. He had me do labs. I went to the lab. I didn't eat after midnight. I followed all the instructions that was given. But he came in that morning. We saw each other again, and he did markings on my body, like where he was going to do my stomach. And I said, "Well, get my love handles too." So he marked everything off, and then he sent me in with the anesthesiologist. And the anesthesiologist was just like, count to 10 backwards, so I was going,
Mhm.
getting put under. And apparently I went into into cardiac arrest right there on the
Oh
spot.
my gosh.
Yeah,
Oh
the
my gosh. So
doctor
you
didn't
never
even get a chance.
had to
Yeah.
to get the procedure done. So you had a reaction to the
No,
anesthesia. Yeah.
Yeah.
And I think our viewers need to know that, when you have surgery, even if it's cosmetic, there is a surgical risk, but there's also an anesthetic risk as well. So you essentially die like on the
Uh,
table. And thankfully, they were able to revive you and get you back to live this amazing life. And so you're here for
yes.
a reason. And
Yes.
I know a lot has happened since then. You've had quite the journey. So, what have you been up to lately?
Living my best life, living and remaining in a beautiful state. I wouldn't say that I'm totally against, surgery or liposuction. I haven't done any since,
But would you
but
do
I'm
it?
not saying I
Would
wouldn't.
you do it again? Would you do it again?
I, you know what? I wouldn't do it in Brazil again. I wouldn't go abroad. I'm nervous about that because I have an experience, and I also wouldn't be put to sleep. So for me, anesthesia, any anesthesia or anesthesiologists are to me only for serious emergencies, not elective. Yeah,
Right, I
no,
get
not for
it.
me. Yeah,
Yeah. Now,
yeah.
here you, have a new book out.
I do. I have a book called
Yeah, tell us a little bit about that. Uh-huh.
Here I Stand in a Beautiful State.
Oh, I love that. And where can we get this book? Because I just feel like you're here for a reason, right? Your life was saved. You're doing all this amazing work. You have your book. And on the creative side, I think you're entering into the design and fashion space as well.
That's right. I have a clothing line called Eli Kish. It's ELIKISH. And then I have Here I Stand in a Beautiful State. And I recount my story in the book in more detail. Like I break it
Mm-hmm.
down from the days I got to Brazil to the emergency. And remember, I was in an outpatient small clinic when this surgery was supposed to take place. It was supposed to be, listen, simple lipo, few days recovery. The doctor said, hey, you'll be able to go home in like 5 days. Just, relax. You'll be sore. But yeah, no, I ended up being in the hospital and they had to, put me into an induced coma and it was really bad.
Yeah, it
Yeah, of
sounds like that was a very traumatic experience for you. That's why I'm so glad you agreed to share your story with us and our
course.
viewers. So thank you so much for that. Your story can help save a life. And I know
Yes.
Dr. I would love for him to just weigh in on what should our viewers be asking the plastic surgeon. Like if you could maybe have a top three or top five of things that
Right.
people should ask the plastic surgeon if they're considering having a procedure done.
Yeah, absolutely. So I would say, first and foremost, you want to make sure that your surgeon is who he or she says they are. And so,
Okay.
not all cosmetic surgeons are plastic surgeons, and not all plastic surgeons are made equal. And so, you want to do your
Right.
homework. I think having a consultation is a very important part in feeling comfortable with your surgeon. But to establish who they are, easy thing that you can go. There's public sites. One is the American Board of Plastic Surgery. You can easily go on there and check your surgeon's credentials. Another thing that you can do is you can go to your state medical board page just to ensure that your doctor is really a doctor. And then
Oh.
to take it a step further, what separates a plastic surgeon from a cosmetic surgeon is
Hmm.
anyone can claim to be a cosmetic surgeon. Like you go a week course with someone and you say, "Hey, I'm a cosmetic surgeon." As a plastic
Wow.
surgeon, let's say you had a surgery, you have a complication, and you need to be admitted to a hospital. Cosmetic surgeon is not going to have privileges to do plastic surgery services or surgeries in a hospital setting because that isn't their specialty. So they're operating out of the scope of their practice. So because I am a plastic surgeon, I can go to a hospital, and because I'm board certified, one of my requirements is that I have admitting privileges to a hospital. So in the event, God forbid, patient has a complication and they need to go to the hospital, I
Mm-hmm.
can continue their care. So they have a continuum of care with the person who actually done their who's done their surgery. So I'm more familiar with what actually happened, and I can, be responsible and not leave my patient stranded. Other thing you want to know is you want to be able to sit there, ask questions, and make sure that your surgeon can meet your expectations. You also want to know the other options. So you go and you see a plastic surgeon and they tell you you don't have any other options, then they may not be the surgeon for you. Like, and then everyone's not a candidate for surgery. So you want someone that's going to be honest with you. And another thing that I would say, you want to know, about your post-op care, who's going to be taking care of you. Is
Exactly.
your surgeon going? Is your surgeon going to see you after surgery? Is there a
Hmm.
number that I can call in the event that I have an emergency, urgency, or question? Because a lot of practices, I've been an expert witness for um, like malpractice cases, and you'd
Hmm.
be surprised. Like sometimes the surgeon does the operation and never sees the patient again. Like
Mm,
you don't want that type of care.
sure. It sounds like the those that are watching need to be mindful of one, to ask if they're board certified, two, to ask if they have admitting privileges, three, to ask if there are any other options other than what you're having done, and then fourthly, do you do you have a contact number? Will you be seeing me after surgery? And who do I get a hold of if I'm having any issues or concerns, right? The thing that I found fascinating about Tamika's story is everything seemed really smooth. And I was wondering if, Tamika, if you noticed any red flags. Like, although, it sounds like your surgeon did all the right things in terms of making sure you did everything on your side, right? In terms of not eating anything after midnight, he marked you, he did all the labs. So, did you notice any red flags?
There were none. I mean, my sister was there with me, and I had an assistant that was there. And no, there were no red flags. Everything seemed, pretty run of the mill. And I didn't eat or drink after midnight. I think it was something wrong with the anesthesia. I'm like, did they give me formaldehyde or I don't know what they did. They gave me the wrong product
Right.
No,
because
it
it
did not
wasn't the
agree
doctor.
with you. Yeah.
Yeah.
So,
Yeah.
Dr. Jones, what are some of the red flags we should look for? Because she didn't really see any that were brazen,
Right.
but what are some red flags?
So, like I said, red flag is one potential red flag is they don't have any any before and after pictures.
Okay.
Or you show up to their office and you're inquiring about you know who's providing the anesthesia, and they're not straightforward or forthcoming with you. um, red flags can be they're it can be very difficult to ascertain a lot of these
Mm.
things because as a patient, as a consumer, you know, marketing marketing can hide everything. And
Yeah.
so if you ask those questions and you're not getting straightforward answers, I would say that's a red flag. But in her case, I mean, it
Mm-hmm.
sounds like everything was pretty copacetic. However, she had an anesthesia related it sounds like it was an anesthesia related complication. And sometimes there isn't anything that you can do about that. Here where I operate, anesthesiologists, basically what happens is so you come into my office, I see you, I create a history and physical, and where I operate, we send that to the surgery center along with your labs. Anesthesiologists or CRNA, they review your information and they check and then they give you a phone call. Hi, I'm such and such. I'll be providing you anesthesia. Have you ever had any problems with anesthesia in the past? They ask
Did
very
they
pertinent questions.
Did they ask you that, Tamika, if you had problems? So it sounds like they did all the
Yeah,
things. So it just,
right. So they
Everything. They
did.
did everything.
yeah.
They
She and
did.
so she just may be the one out of 100,000 or 300,000 who had an anesthesia related complication. However, one
I
thing
mean,
that just looking at her
Go ahead.
case, I would be very reluctant to operate on someone who was 2 months postpartum, and the reason being is your body has not re-equilibrated. So there's an inflammatory state. So you're at higher risk for a DVT. You still have swelling, and so you need to let your body completely heal so that I can better assess whether or not you even a good candidate for liposuction. But other than that, I don't even have any issues with what happened. The biggest concern for me is she was in a foreign place, unfamiliar with the
yeah.
facilities and whatnot, and she probably didn't know anything about the hospital that she was transferred to, the type of their standards. And then, let's say she needed further care and she needed to be transferred somewhere else, it would probably be very difficult for her to be transferred from Brazil back to the United States.
And so what was that like, Tamika? Because you lived it, you survived it, and to tell your story. So walk us through that.
Well, I went to the equivalent of like Cedar Sinai of Brazil. It was Syrio Libanese. It's their like a really big hospital. So I guess yeah. So I the clinic where we did the procedure, they transferred me to the main hospital, and it was actually I guess a good hospital,
Mm-hmm.
in Sao Paulo. And I just stayed there I mean, they took good care of me. I remember, I was hooked up to all the machines and the catheter and the whole nine. When I got back to the States, though, I went to a cardiologist that they did
Mm-hmm.
find that I have a mitral valve prolapse. So
Okay.
I don't know if that played a role in it, the
Mm-hmm.
MVP thing, but
Mm-hmm.
they said it shouldn't have. The cardiologist said it shouldn't have.
Sure.
But
Yeah.
I feel like maybe it was just the wrong anesthesia. I think there was an anesthesia issue because it wasn't the surgery. I didn't do the surgery, so it
Yeah.
had to do
But
with anesthesia. Hmm.
yeah, but Tamika, I think that kind of hones in the point that Dr. Jones was making is just make sure they get a good history. And sometimes we don't know our full history because we haven't experienced it. We haven't been challenged with anesthesia before or
Yeah.
challenged with
Great.
surgical procedures. So the takeaway is to make sure you share that history as much as you can with your doctor. Be very truthful because a lot of people will
Hmm.
doctor shop and just go to whomever will do their procedure. The second thing is just to make sure, like you did, you did your due diligence, so it didn't sound like you did anything wrong. So there,
I'm good
uh,
at market. I'm not trying to
yeah,
do nothing.
you are the poster child for
My
it.
hands done. I had my hands peeled so they would look smoother. That's it. I'm like, I'm good.
Yeah, yeah,
I
for
learned my
sure.
lesson.
But I well, this has been a lively, lively conversation, and I'm so glad that you all sat down with UrbanMD TV to help inform our viewers. The purpose of UrbanMD is to MD TV is to share things with our diverse audience through a multicultural lens, and it really has a huge impact when people can see that this is for us, by us. You're telling your personal story. You didn't have to do that. I know you do share your story details in the book. So please get the book. It is a wonderful read. It is a page turner. Like you can go through this book in like 2 or 3 days. Like it is very, very exciting. It takes you on a ride. And if you're
Yes.
considering, especially awake lipo or any of the procedures, Dr. Jones, we definitely going to make sure our viewers are able to see you for your procedure. So how can our viewers get a hold of you or your office? And can we
So
get a
I'm
quick
located.
discount?
Ah, yeah,
Yeah.
absolutely. So I'm right here in Buckhead, Atlanta, Georgia. My office number is 404-777 Tuck TUCK, or you can find us on the internet. Our website is drnippintuck.com. And then we're also on all social media platforms.
I love it. I love it. So anyway, we're going to sign off for now, but we're hoping that you all will follow us on all digital platforms. Make sure you get Tamika's book and also follow her on social media, and Dr. Jones online, and also on Instagram, so all social platforms. And also follow UrbanMD TV on all digital platforms. We're on Instagram, YouTube, Facebook. We really want to make sure that this is for us, by us, and get the information that you need to live a healthier life and to just thrive in 2024. And so we am so happy that you guys have joined us today. Again, I'm Dr. April Spencer, co-host of Urban MD TV, the first and only national TV program that is designed to promote healthy lifestyles to a diverse audience through a multicultural lens. So until next time, be well and make sure you tune in to our next episode. We'll give you guys a teaser really soon on what we're going to talk about next. Take care.